So do you know why some women have some bleeding issues during pregnancy? So the most common reason for bleeding during pregnancy is implantation bleeding. So that is when the embryo is getting deposited in the uterus and burying itself inside the layers of the uterus, that is inside the decidua, some amount of bleeding can occur. So this is called the implantation bleeding. So in such a situation, we need to give these women some amount of progesterone and keep them under rest so that the bleeding stops and the pregnancy continues. So another reason why the women will have bleeding is because of the missed abortion. Meaning the embryos are formed but the embryos are not of good quality, and as a result the heartbeat does not develop at 6 to 7 weeks, and when we do a scan there will be an absent heartbeat and irregular sac. In such a situation, again the women will start bleeding. So if it is a missed abortions, then we do not have a choice but to take the embryos out by giving certain medications. But sometimes the women also can have some amount of bleeding because of a threatened abortion. That is, there will be some amount of hormone deficiency, and as a result the uterus is trying to push the embryos out. That is, it is threatening the uterus to expel the embryo. In such a situation, we will give them again the progesterone medications and keep them under rest so that the pregnancy continues without difficulty. Apart from that, various other factors why the women has bleeding is mainly because of the position of the placenta. Sometimes the placenta gets lodged in the lower segment of the uterus, which we call it as placenta previa, and because of this she may have some amount of bleeding. Apart from that, there can also be separation of the placenta from the uterus, which is called the abruptio placenta. So this can also produce bleeding. So towards the end of pregnancy, some women can have a preterm labor, and because of that they will have bleeding. In such a situation, we try our best to continue the pregnancy as much as possible by giving a certain uterine relaxant and also progesterone medications, and also enhance the maturity of the baby's lung by giving either the steroid injections, either the dexamethasone or betamethasone. So these are the various factors why the women have some amount of bleeding during pregnancy. So based on when exactly she is having the bleeding and why she is having the bleeding, we treat them accordingly.